Beamer, yes, Beamer is a good example. Beamer belongs to the 10 companies out of the 250 who at least have a medical device license in Europe. So they are more or less doing legal business. Not in Canada, because they have no Health Canada license. And illegal in Canada because their claims and intent of use does not qualify them as a wellness device. So they would have to have a Class 2 license in Canada. So if a Beamer system is sold in Canada right now, send me the invoice, we will send it to Health Canada, they will be off the market. Right away. Because they will review their websites, they will review their owner's manuals, and they will figure out that their claims are not qualified as a wellness device, and they will definitely be off. They will not be off, they will be, you get a nice letter from Health Canada. We figured out that you are, according to your claims, your device has to have a Class 2 Health Canada license. Please provide us with this. This is the way they talk to you. Right now it takes between 18 and 36 months to get it done. Because you have to start from scratch, you have to, you know, the authorities have a big problem, they don't have enough manpower. They try to clean up the market right now, that takes a lot of manpower. So they can only do a case at a time. And so the biggest problem right now is the waiting time to get something done. And of course you have to do all your duties, you know, to get all these nice certificates, biocompatibility. You have to put everything in the laboratory to get checked, and this is really a lot of work and a lot of money. So a complete new certification, Health Canada Class 2, if you manufacture in Europe, what Beamer does and what we does, it's about $250,000. And about between 18 and 36 months of waiting time until you finally get your certificate and can release it. And why I tell you all this, because if you are in the market, if you detect a competitor who is doing unethical business, with unethical, I don't mean they put us in a bad light, because this is just cheap, it's not unethical. But unethical means they make claims which they cannot do according to their legal situation with the National Health Authority. Let us know, and we will definitely eliminate them. We are in good standing with Health Canada. We are in good standing with the FDA. Coming back on this project right now, I put Greg on this project. He visited several workshops of Advamed. We are in dialogue with the FDA right now. The FDA is happy that at least one company is approaching them. We showed them everything we do. They know everything about us. They know about the Omnium, they know about the IMRS. They checked our websites, they checked our manuals, so they are aware of what we are doing. And they are also aware that we do compliance workshops. They were really thrilled about hearing this. So actually, the entire relationship with those authorities are changing, I couldn't believe that, in a way that we figure out that they are not so bad. You know, if you approach them and if you tell them, this is the product, this is what we want to do, so now tell us what we have to do. And the next step will be that we are seeking the possibility, and I'm really positive that we're going to achieve this, to regulate PMF together with the FDA, with its own product code and with its own requirements, what a unit needs to provide in terms of good manufacturing practices, in terms of which certificates have to be met the classification, and so on, so that we can finally 100% legally market such devices, and we set the standards for every competitor and say, this is what you have to do, and then you can come to the market.